Amyotrophic lateral sclerosis, or ALS, is a neurodegenerative disease that affects voluntary muscle movement. This disease is caused by the death of motor neurons, which send messages to your muscles that allow for muscle movement. So when these motor neurons degenerate and die, no messages are sent to these muscles, which cause the muscles to weaken and start to twitch and thin. This causes early symptoms such as muscle twitches in the arm, leg, shoulder, or tongue, muscle cramps, tight and stiff muscles, and difficulty in chewing or swallowing. However, this disease is progressive, so symptoms will continue to worsen. People with ALS eventually will not be able to stand or walk, chew or swallow food, and will be unable to breathe. People with ALS eventually lose the ability to breathe on their own and must depend on a ventilator. They must also avoid foods that are difficult to swallow. ALS usually appears between the ages of 55 and 75 and appears more commonly with the male sex. It is also important to note that ALS is mostly sporadic, which means that it strikes at random, without a genetic cause. Although family members of people with sporadic ALS are at an increased risk for the disease, the overall risk is still very low and they will most likely not develop the disease. 10% of ALS cases are genetic, but these cases are caused by a variety of different genes and not one specific one. Overall, people with ALS usually pass away 3 to 5 years after symptoms start to appear. There are no cures for ALS, but there are treatments which ease the symptoms of the disease. One treatment, riluzole, reduces damage to motor neurons by decreasing a neurotransmitter called glutamate. Glutamate typically rises in ALS, which is one of the causes of the death of motor neurons, so decreasing the levels of glutamate will preserve the number of motor neurons in the body and prolong life for a few months.